The book Dental Caries and Traumatic Injuries in Pediatric Dentistry. Current Concepts in Clinical Practice, by Harsha Vyas, Nikhita Gune, and Pooja Balgi, was published in 2025 by Springer Nature Switzerland. All three authors are presented as specialists in pediatric and preventive dentistry. The book belongs primarily to the field of pediatric dentistry, with a strong focus on prevention, restorative treatment, endodontics, and dental traumatology, and is intended for pediatric dentists, residents, general dental practitioners who treat children and students. The central concept of the book is contemporary. Dental caries in a child should not be viewed merely as a cavity that needs to be restored, but as a disease process whose risk factors should be identified and modified, while the success of dental trauma treatment is determined not only by the procedure performed on the day of injury, but also by preservation of the pulp, periodontal ligament, root development, and long-term follow-up. The authors state that their aim is to translate scientific evidence into practical algorithms, clinical cases, photographs, and decision-making maps. The 15 chapters are well structured internally. Caries risk assessment, professional and home-based prevention, remineralization, minimally invasive dentistry, direct restorations and prefabricated crowns, followed by vital and non-vital pulp therapy and management of the immature permanent tooth. Then trauma to the permanent and primary dentitions, late complications, cone beam computed tomography, and orofacial trauma. The reader therefore first develops an understanding of disease and prevention and then applies the same principle of biological preservation to treatment and trauma management. The scientific foundation is good and highly current, although it is not equally strong across all chapters. The reference lists include guidelines, systematic reviews, meta-analyses, randomized controlled trials, and papers published in 2025. The chapter on pulpectomy, for example, cites recent systematic reviews comparing rotary and manual instrumentation in primary teeth. However, the book does not use a formal system for grading certainty of evidence. Some recommendations therefore represent the author's synthesis of several guidelines rather than conclusions derived from a single high-quality source. The preventive protocol is a good example. The authors state that they combine several international systems and, unlike most guidelines, propose professional fluoride application even for children at low risk of caries. This may be justified, but it is not a universal recommendation. The first key clinical message is the routine assessment of caries risk and individualization of treatment. The authors link existing lesions, plaque, diet, salivary factors, social factors, and fluoride exposure to the prevention and treatment plan. This concept is strongly evidence-based. The second important recommendation is selective caries removal in deep lesions without signs of irreversible pulp inflammation. The peripheral areas are cleaned to sound tissue, while firm or soft affected dentin may be left toward the pulp, followed by placement of a well-sealed definitive restoration. Here, the author's recommendation has good scientific support, and contemporary guidelines on vital pulp therapy independently support selective caries removal in appropriately selected cases. The third key area is preservation of pulp vitality. In primary teeth with deep caries, the authors favor indirect pulp treatment when there is no spontaneous or nocturnal pain, swelling, abscess, root resorption, or periapical radiolucency. After pulp exposure, they recommend pulpotomy with calcium silicate cements if the remaining pulp is vital. In immature permanent teeth, the goal is to preserve pulp vitality and allow continued root development, whereas in teeth with pulp necrosis, the choice between an apical barrier and a regenerative endodontic procedure is adapted to the stage of root development. The long-term predictability of regenerative procedures is not equivalent to that of routine therapies, which the authors acknowledge by emphasizing the need for clinical and radiographic follow-up. The fourth area is trauma. The book is based on the 2020 guidelines of the International Association of Dental Traumatology and links clinical decisions to age, type of injury, and stage of root development. In the case of avulsion of a permanent tooth, emphasis is placed on replantation as early as possible, proper handling of the tooth, use of an appropriate transport medium, and particularly long-term follow-up because of the risks of pulp necrosis, inflammatory resorption, ankylosis, and replacement resorption. This framework remains contemporary, although some recommendations in dental traumatology necessarily rely on observational studies and expert consensus. It is particularly valuable that the authors do not present three-dimensional imaging as a routine procedure. Clinical examination and conventional radiographs remain the initial standard, while cone beam computed tomography should be used when the additional anatomical information it provides can justify the higher radiation dose. The practical value of the book is high. Procedures, indications, contraindications, materials, photographs, radiographic findings, and long-term follow-up are presented. It is particularly valuable that the book does not show only ideal outcomes. One case involving an immature permanent molar demonstrates late periapical pathology many years after treatment. This illustrates that a technically successful procedure does not guarantee long-term success. Communication with parents is well integrated through counseling on diet, home care, risks, and the importance of follow-up after trauma. The first major strength is algorithm-based decision-making, which is particularly helpful for younger clinicians in linking indications to the biology of disease. The second is visual teaching. Clinical photographs, radiographs, tables, and procedural sequences make complex treatments easier to reproduce in clinical practice. The third is the current literature, including guidelines from 2024 and papers from 2025. The fourth is a consistent philosophy of preserving dental tissues and pulp vitality. The fifth is a serious approach to trauma-related complications and follow-up. The first limitation is that readers must distinguish for themselves between a guideline, a systematic review, a clinical series, and an experience-based recommendation because the level of evidence is not formally identified. Second, the book occasionally formulates recommendations more strongly than the cited evidence appears to justify. The chapter on remineralizing agents, for example, broadly recommends commercial calcium phosphate preparations for high-risk patients, while the same text acknowledges that many formulations are comparable with standard fluoride products and that the additional benefit is not always clear. Third, some recommendations require verification against contemporary specialist positions. In the case of pulp canal obliteration following trauma, the book permits aesthetic treatment, with or without prophylactic endodontic intervention, whereas the European Society of Endodontology does not recommend endodontic treatment of an asymptomatic tooth without signs of irreversible pulp inflammation or apical periodontitis. This is a genuine and clinically important point at which the book should not be followed without additional verification. Fourth, the large number of commercial products makes the book practical today, but these are precisely the sections that will become outdated most rapidly and will not be equally applicable in all countries. For students, the book is excellent supplementary reading, but it is not a substitute for a comprehensive textbook of pediatric dentistry. For dentists at the beginning of their careers and general dental practitioners who treat children, it has very high value. Residents receive an excellent clinical handbook, while specialists and university faculty will appreciate the algorithms, illustrations, and literature, although they will need to consult the original guidelines when dealing with controversial issues. The three most important professional concepts are straightforward. Caries should be treated as a dynamic, risk-based disease process rather than merely by restoring its consequences. Preservation of pulp vitality and dental tissue should be prioritized whenever the diagnosis permits. And in dental trauma, the outcome is not assessed on the day of injury but over months and years of follow-up. Does this book deserve a place in a professional library? For pediatric dentists, residents, and dentists who regularly treat children, yes. A dentist whose practice is almost exclusively limited to adults may reasonably skip it. Its greatest value lies in translating contemporary evidence into concrete clinical algorithms and visually clear procedures. Its greatest weakness is the insufficiently clear distinction, in certain sections, between high-level evidence and the author's own clinical protocols. It is best used as a clinical guide and reference manual rather than as the sole source for every treatment decision. If you treat children, this book is worth the time required to read it because it teaches not only how to perform a procedure, but also when to choose it, when to avoid it, and what must be monitored afterward.